Hi, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. So happy to have some time with you today on this Friday. And we have a very important conversation for you this Friday. As those of you who've been following our YWTV know, our association here in Northern New Jersey has been very focused this year, being that it's an election year, on a report that was published by our national organization, YWCA USA. And we'll put the link to the report for you here. But it focuses on the issues that women should be thinking about when they are voting in November. And, we have covered a lot of the areas and tried to do a deep dive into conversations on a lot of the areas that were highlighted as key issues for women voting. And obviously, there's a presidential election this year, but there's a lot of other very important elections that are happening as well along. And one of the areas that is a big area for focus for this election has to do with healthcare costs and insurance coverage. And again, political differences, when it comes to areas for women's health and making sure that women have coverage and women can get the care that they need, needs to be put aside and been focused on the issues as our sentiment here at the YWCA of Northern New Jersey. And so with that, we're so grateful to have with us today, as part of our Why Women Vote series, President and CEO of the New Jersey Healthcare Quality Institute, Ms. Linda Schwimmer. And she is here to talk with us about the best practices around healthcare. So in case you are not aware, New Jersey Healthcare Quality Institute is an independent, nonpartisan advocate working in New Jersey to promote accountability and transparency within the healthcare industry. And I'm so grateful that Linda could make time in her busy schedule to be here with us. I'm going to let her talk about the organization in a minute, but I'm going to tell you a little bit about her and her background. As I said, she's the president and CEO. She drives policies that advance healthcare safety, access, and affordability. She's committed to change that improves healthcare for every person here in New Jersey. Under her leadership, the Institute is focusing on collaboration and innovation to accelerate policies that make healthcare and health more person-centered, transparent, and equitable. She is also a respected voice in the national movement to promote quality, safety, and transparency in American healthcare. She sits on the board of the Leapfrog Group, a national patient safety advocacy group. And she also served on the board of the National Quality Forum. She also served as co-chair for Governor Murphy's transition team on health. And we are so grateful to have you here today, Linda. Welcome.
Thank you. It's great to be here. Thanks for the opportunity.
Oh, I'm so glad that you can help us talk through this issue, because I know it can be complex. But before we do that, can you tell us a little bit about your work at the Institute?
Sure. The Quality Institute, we're based in Mercer County, New Jersey. Although, like many of you, we're all working virtually right now. We have been around for a little over 20 years. And we work to improve safety, quality, and affordability of healthcare. We do that with a lot of our members who are our partners. We have about 115 different organizations that are somehow involved or engaged in healthcare, everything from consumer organizations like AARP and the YWCA and the YMCA to insurers, hospitals, pharmaceutical companies, physician groups, nurses, et cetera. So we all work together on different initiatives that really focus on our vision, which is creating a world where we can all live our healthiest, best lives. And we work on programs such as getting out the word on how to have conversations about what our wishes are, particularly at the end of life. And we also work at the very beginning. We do a lot of work on what high quality, equitable reproductive health looks like. And we just created a reproductive health toolkit, which is out there to help healthcare providers really engage with their patients and give them all the different options and what's good for them. So it's really, before life, end of life, the whole gamut. We also work really closely with mayors and communities to really help them make their communities better places for people to live, work, and play. So I encourage everyone to go to our website. There's a lot of information there. And I know I'm going to be sharing a lot of different resources as well. And the YWCA is going to put out a reference link to a lot of the resources as well. So just know that we're out there to help anyone who's really looking for information on how to get healthcare coverage and access and how to afford the care they need.
Wow, we're so lucky to have you as a resource here in New Jersey and pulling together such a amazing array of providers and organizations to be working together on these important issues. So this must be a very interesting time to be doing this work.
Right. It is. It is.
I mean, it must have been interesting before this year hit, obviously, in the climate of the last few years. This has been, such a, honestly, the last decade, right? This has been such a topic ongoing, that we've had, but we sure have made a shift, even more recently. So, knowing all that, can you give us a kind of current status of where we are with affordable healthcare and secure healthcare here in this country?
Sure. That's a big question,
Yeah,
but let me try to tackle it in a couple different bite-sized pieces. I think that the current pandemic that we're in has really highlighted for all of us just how essential healthcare is. I mean, healthcare is a fundamental right, and having access to care when you need it is critical. And if we didn't know that before, we certainly know it now that we're in the middle of a pandemic. And I think that the government, both at the state and federal level, have also made that clear in very quickly putting into action some executive orders, changing a lot of the ways that people can get care and have to pay for care. So for instance, the COVID testing and care related to COVID, or care that you can get now through telehealth, because that's become so critical because of the social distancing. A lot of the rules around that have changed, and there's no cost sharing for many people, not for everybody, unfortunately, but for many people. So, those are some changes that have been put into place. But a lot more is coming up, and I know we're going to talk about that. Here in New Jersey, we're going into what's called open enrollment. So this is going to be the first time that our state has ever had its own state-based exchange where people can buy insurance. So that's a new development. And despite all of these changes and the focus on healthcare, we're still struggling with the unrelenting cost of healthcare. New York Times today had a big article just comparing how much we pay in the private sector market for healthcare, particularly for hospital care, compared to Medicare rates. Oftentimes, more than 2.5 to 3 times to 4 times as much. All of that cost that goes into our benefits rather than organizations being able to hire more employees or provide better benefits or raises for people. So these are all really important issues, both from a life-saving standpoint and a pocketbook standpoint. And it's not a surprise that when people are polled and they're asked what's important to them in the election, for instance, that healthcare is typically, one of the top 3 responses that comes up.
So when people are, you raise the issue about so many people having to pay out of pocket, and not getting, compensation through their insurance or not having it, what can people do to help with medical expenses that they can't afford? I mean, I can imagine, again, especially now with COVID, definitely complicates things even more, I'm sure. But how are people where are they to go? What resources are available for them?
Yeah. No, it's a great question. And so it really depends on everyone's personal circumstance. So for people who make less than 138% of the federal poverty level, and people don't walk around knowing exactly where they fall on a federal rating scale. So my suggestion to you is, if you don't currently have health insurance, or if you're struggling to afford your health insurance and you want to find out where there's better options for you, to go to a website that was created by New Jersey called Get Covered NJ. And you can go there, and there's a calculator, and you can plug in your information and start to poke around and at least get a sense of what the options are to you. But so for people who make less than 138% of the federal poverty level, and it's going to range depending on how large large or small your family size is, you are eligible potentially for what we call NJ Family Care or Medicaid. So fully paid for comprehensive health insurance, which includes care in the hospital, to see doctors, clinics, as well as dental and drug costs. So if it's something you're eligible for, it's a very comprehensive plan, and it can be life-changing and life-saving. If you make more than that, depending on, for instance, if you're pregnant, it can be up to about 200% of the federal poverty level. And then if you make more than that, you can purchase insurance on the state's exchange. And if you make up to 400% of the federal poverty level, which for an individual is about $51,000, and for a family of four is about $104,000. So now we're starting to talk about, a larger number of people in New Jersey. You're eligible for subsidies. Depending on your income, you might be eligible for other cost sharing supports, which helps you pay all the out of pocket. And New Jersey, for the first time this year, has its own cost savings plan, which it's putting into place. It's its own state funded premium support. So there's at least 3 streams of support for you in the commercial market as well, in the individual market, to purchase and to help pay the out-of-pocket costs for health insurance. Again, it's not going to cover everyone. It's really focused on people, up to 400% of the federal poverty level. So it's low income, reaching into more moderate income, actually. And then in addition to these insurance programs, there's also various pharmaceutical prescription drug support programs, and we'll provide the links to all of those things. One of them is it's New Jersey 211, but we have some other links and resources that people can go to, because prescription drugs in particular, the out-of-pocket costs for things like insulin that's been in the news a lot, and that definitely is an ongoing issue, particularly for people who have drugs that can be very, very expensive for rare diseases and things like that.
And just for our viewers, I'm sure you're seeing we're adding all the links in the comments, and that Linda's sharing with us. You can find them there. Get Covered New Jersey 211 and the report. And she's also provided for you information on the Institute and how you can access them as well, and on their different platforms. So, there's a lot of great resources out there. We thank Linda that she's been sharing them with us, but you can, get to them and look through them at your leisure. They'll all be sitting here, and this broadcast will remain on our Facebook page. And if there's someone in your life that you wish had seen it, but isn't watching it with you now, don't despair. It will be here and they can watch it later. So Linda, COVID, obviously you've mentioned it a few times, and, it definitely has impacted so many areas of our world, but healthcare and access is definitely one of them. How has it complicated your or changed your work and shifted your focus, during this time to be able to support and educate and advocate? So much going on.
Yeah, I mean, we already the Quality Institute's employees already were used to working sometimes in the office, sometimes from home. So for us on an individual level, we were able to pivot pretty quickly. We, as you can imagine, run a lot of work groups, pulling together people to, kind of work on how would you improve or redesign something. So making all of that work virtual has been the biggest shift for us, and getting used to doing this sort of thing where you would normally do in person. And it's going okay. I mean, it's actually going better than I thought. And I think we're all getting better at using technology. But one of the things that we're spending a lot of time doing in these conversations is really tracking what's been working, what's the changes that have happened when in a crisis, you kind of have to push aside a lot of the regulations and rules and things that maybe were in place just because they've been in place for a long time and no one really thought about modernizing or refreshing them, or even if you thought about it, you just didn't have time because government's always strapped for resources. So looking at those changes and saying, hey, these things have actually been really positive in terms of providing better care for people, more patient-centric care. And telehealth, I think, has really been probably the shining star in that. For many people having to, and I'm sure your listeners, on here can relate to this. You're working full time, you've got kids, you've got daycare issues, you've got transportation issues, and dragging people around from place to place to have a 10-minute appointment and waiting in a waiting room for an hour. It's very disruptive to, particularly working women who have to have everything so orchestrated and organized. And, it's just a challenge getting from place to place. Being able to have telehealth visits has been a real blessing to a certain extent. But for other people who don't have access to technology or, great Wi-Fi, or, it hasn't been as great. So really taking a look at that, looking at the ways that it's changed. A lot of, now doctors are able to have visits on FaceTime. Before that wasn't possible because of all of the HIPAA regulations, because they weren't protective enough. So really kind of looking at those issues and saying, which worked, what didn't, how do we fix it? But that's going to be, we have catapulted forward in that realm. A couple other thoughts. I think COVID has really highlighted some key parts of the healthcare system that we need to make sure that it's really highlights some of the most important parts of it. Having a family physician or a primary care provider, could be a nurse practitioner as well, but somebody who is trusted, who you're connected with, who knows you, can be so important, whether you have a chronic condition or whether you just see them every now and again. Having the connectivity to the healthcare system, particularly in the middle of a pandemic, having somebody who you can quickly reach out to and get, facts, because there's so much information out there that's just not accurate. You can get facts, you can get referred for a test, you can get the medications you need, you can just connect in quickly with, really should not be underestimated. And think about that. If you don't have a primary care provider that you're linked into, make an appointment with one. They are open again, or do a telehealth visit with one, but it really is a part of good health. The other thing is just getting that ongoing care, whether you're making sure that you're staying on your prescriptions, or really, really important, if you were getting mental health services, if you're, your therapist before, keeping that up is just critical. I mean, the skyrocketing mental health issues is really no surprise, but it just shows how critical it is. And then keeping up with vaccines and immunizations too. I mean, those just dropped off, and that's a really important part of good health. So I think, those are the things that we've been thinking about, worrying about, and, want to get the word out on how to continue.
Well, it'll be interesting to see how many of these pieces that came into play during this time stay with us long term, right?
Mm-hmm.
Because obviously some of them, as you said, were innovations and, pushed forward progress, maybe in some areas,
Yeah.
But it definitely did highlight, like you said, technology and some of those challenges that did keep it from being something accessible to everybody. As you probably know, our work in the YW, I know, as we talked before we went live, and congratulations, you're a twin honoree from our Princeton Trenton Sister Association. So I know you're familiar with our YW work, but we spend a lot of time focused on eliminating racism and discussing systemic racism and issues there. And I think that that's been one of the areas that we have also seen a lot of attention to. Sure, we've for sure seen this progress, but the issues with technology, and even in our own organization, we do sexual violence counseling for Bergen County. We're the state designated provider. And it's been wonderful. Our team so seamlessly transitioned to doing counseling online with, HIPAA appropriate technology. But we really had to work through the clients that didn't have access, to the technology to be able to support them and figure that out. So it's wonderful to see, I think, the innovation, but it definitely has left us with conversations, and more attention that needs to be put on the areas that we have to focus to support so that there can be equality in terms of, access for sure.
Yep, absolutely. And I know that, whether it's domestic violence or all those issues have been heightened by this, with kids not being in school. The reports and referrals about domestic violence have really gone down. And I mean, that's really why one of the many reasons why we really need to get a handle on this pandemic, and so that we can start to return to some of the normal functions of daily life, including school, because having more eyes and ears and having a safe place, having, a place for hot meals and nutrition, like all of these things our schools have really become, a really critical part of our social service network. And those are the children that are most vulnerable and being left behind in this pandemic. Yeah. And it's heartbreaking, but it's why we need to all do a much better job of taking the public health suggestions seriously, because we're not going to get out of it otherwise. And those of us who are, lucky enough to be in a good situation, it's inconvenient really. But for those who don't have, are struggling with these other issues such as domestic violence, it's life-threatening. So it's tough.
Yeah, it's such an important piece what you just raised. I think that if people don't have children in schools, and right now, either because they don't have children or their children have aged out, and even the ones that do have children in school, if they're not using those services, they're not aware that schools really are lifelines for so many families in so many ways, with so many of the services that you're talking about. And also, they really are the eyes and the ears to report back to the state agencies if there is some thing going on, that they can report the concerns that they're seeing in a family system. So this really, this time has definitely placed a strain, for those families for sure, and being able to get those supports from our school systems. So, well, this has been a great conversation. You've really highlighted a lot of important areas for discussion. I have one more question for you before I, close us out. And it's another big question, as they all have been. We're obviously getting ready to vote under, I don't know, what are we, 47 days away, 46 days away from the big elections, that are looming. What are the key pieces of legislation that we should be thinking about around healthcare and considering when we're looking at candidates, for November? I think, part of our obviously goal with these discussions and the Why Women Vote series is to be able to support women in kind of drilling down and identifying candidates who match their needs and their value systems. So we want to be able to give them an idea where to go look and focus to find the information that connects with them for their voting.
So I know you started out in the beginning, but I'll just say again to remind everyone that the Quality Institute is we're a nonprofit and we're nonpartisan, but we do a lot of research and we are obviously tracking all these issues and very familiar with what the differences are in the various candidates and their positions and their track record and history on healthcare issues. So again, just a couple resources because there's just too much to share in this short snippet. So Kaiser News, Kaiser Family Foundation has some really great nonpartisan resources which lay out the differences between the two candidates on a lot of key healthcare issues, as well as their track record. And from Vice President Biden and his many decades in the U.S. Senate, and then as Vice President as part of the Obama administration, obviously a huge proponent of the Affordable Care Act and what it brought to the United States in terms of changing our healthcare system and putting into place some requirements and mandates at the federal level versus President Trump and what his statements and focus and actions have been over the past 4 years. There are some pretty clear differences. I'll just touch on a few that I think are most relevant for this audience. First of all, reproductive health. This is I'm YWCA. So although reproductive health is critical for everyone, not just not just women, but there's a very clear distinction between the position of the two parties. With the platform of the Democratic Party and with Joe Biden coming out very vocally, clearly pro-choice and would roll back the changes that were made under this administration to Title X funding. So right now, Title X funding, which is contraceptive care, those agencies are not allowed to counsel their patients about the availability of abortion services. They are not allowed to refer people to abortion services. And I would assume that current policy would be continued by a second administration under Trump, whereas Biden has very clearly said that would all be pushed aside and eliminated, and that it would be clear communication based on the medical needs of the patient. When it comes to the Affordable Care Act, Biden has said that he would expand the Affordable Care Act and increase the subsidies. At the very beginning, I was talking about those levels of subsidies. So he would add to those so that they would be more accessible for more people, depending on your income. The Trump administration is currently fighting the Affordable Care Act in federal courts and is looking to repeal the entire act. They're looking to, rather than having the Affordable Care Act, which requires that a whole host of types of care be covered. They would like to see more flexibility in the healthcare system. So a health plan could offer a plan that maybe covered prescription drugs, but also maybe did not. They would also like to go back to rating based on health status and gender. So we had that before. And when we had that, if you were to go and look back at the rates, women in their 30s, here in New Jersey, as well as other places across the country, paid more for insurance than men in their 30s, because women in their 30s obviously can get pregnant and men cannot. And pregnancies are expensive or more expensive to a health insurance company. So if you're thinking about, how you would like our health insurance system designed, I mean, I think these are pretty clear differences. Yes, when you make everybody sort of all in pay for these types of services, it can make it a little bit more expensive for everyone, but it also adds that level of equity in that you're not putting the full burden on a smaller group of people. These are, what I find so interesting about healthcare policy is it really goes back to what are our values? What do we care about as a society? And sort of this whole tension between the individual and the society. And that's really what this debate really comes down to. Individual, society, how do you share costs, things like that. That's why it can get so emotional, for people. But I really encourage you to go to that Kaiser website. I think it's got a lot of great information, and these are critical issues that will affect, your family, your pocketbook, your future, and healthcare is probably, healthcare and immigration are probably the two issues. Well, environmental too, I'll throw that in there. But I mean, there are some really stark contrasts. So when I hear people say, "Oh, there's no real difference between the candidates," I don't think that people who are really looking into the issues could ever say that, because there are stark differences. And I'm not saying which side you should come down on. I'm just saying you should be aware of the stark differences, because they're great. They really are.
Yeah, I agree, and I think that's why we launched this effort this year, so strongly, and kudos to our team at the YW, who's been pulling together such great speakers to do this deep dive into this wonderful report that our national organization put out, because there are differences, and we do need to be thinking about, obviously at the YWCA, our focus is that supporting women, girls, and families is supporting everybody. And that, if these issues are aligned with, our needs and our values, then it'll be, aligned for all. So I thank you so much for shedding so much information and, clarity around some of these issues, and giving us resources to be able to learn more. We have the Kaiser Family Foundation link has been added since we started talking at this last piece, Linda, as well. So it's all here for our viewers to check into. We're so lucky to have the Institute and Linda here in New Jersey, and I do hope that everyone makes a point of following them on social media, staying connected to the work that they're doing. It sounds like there's lots of opportunity to get involved and educated, for sure, on what's happening here in our state and nationally on these issues, and a wonderful nonpartisan organization to be able to give you the facts so that you can make the choices that make the most sense for you and your family. So Linda, thank you so much for all this information, and we look forward to continuing talking to you. I'm sure it'll be interesting post-election, and as COVID continues to work itself through, to see, what comes next in this landscape of healthcare and how it's all impacted and evolves from what's ahead. From what's ahead.
Yeah. Okay, well, thank you. I really appreciate the opportunity and wish everyone to stay healthy and go out and vote. Or don't go out and vote. Mail your vote in.
Well, yes, make sure you mail your vote in. For our viewers, just know we will be having a show on that. I believe it's next week, talking in detail about how to do it. Because I know that it's different this year, and so we don't want any confusion to lead people to not getting their vote in. So we will be having that conversation. And that's part of our countdown to Election Day here at the YW. For those of you that are getting ready to celebrate Rosh Hashanah, we wish you a peaceful and healthy New Year. Happy, healthy New Year. I know holidays are a little different right now, possibly, with obviously less family, but nonetheless, hopefully immense gratitude. Our 21-day Racial Equity and Social Justice Challenge is in motion. We have over 600 people signed up that are doing the challenge with us right now. We have a goal at the YWCA of Northern New Jersey to have 20 people signed up by December 31st. We find it to be incredibly important to build effective social justice habits, particularly around race, power, privilege, and leadership for everyone in our community. So we do hope that you join us in our 21-day challenge. You can start today. You don't have to wait. And whenever you sign up, your 21 days, your ticker will start from there. So we also have a Facebook group that's working, side by side for anyone who wants to be engaged in discussion while they're doing the work. I have to say the feedback has been phenomenal. We thank our sister association who we had on the show out of Cleveland, Ohio, that developed this challenge. And we have been really getting great feedback from everyone who's been doing it. So we encourage everyone to do it. Linda, sign up. We'll get you on it too. But it's really been a great opportunity for learning. And Empower University, if you have a 10th grade girl in your life, we would love, and you're in one of our 5 counties, Essex, Morris, Bergen, Passaic, or Hudson County, we'd love for them to join our virtual Empower University, our Girls Leadership Academy, which kicks off at the end of this month and goes for 10 months, which will allow these young women to meet over 60 mentors, women in our community doing different type of work, and getting some evidence-based learnings on key areas to help shape them on everything from climate change to economic self-sufficiency to good habits for yourself socially and health-wise. And so we encourage you to get the young women in your life active. And again, vote.org. You can get information to be prepared for Election Day. But we will, as I said, be sharing some more information on that on YWTV next week. So everyone, stay well, have a wonderful weekend. And also we posted an article this morning on our Facebook page about Theodora Lacey, who, if you have been following, a wonderful article on the news last night, a wonderful story in the news last night. She's a civil rights really legend that lives here in Teaneck, New Jersey, and a school was named after her yesterday. They had a wonderful ceremony honoring her and the legacy of her work. She helped desegregate the schools in Teaneck and is an amazing, amazing leader. We have a Racial Justice Award named after her here in Bergen County, and she's a strong friend of ours, but I just wanted to shout out and congratulate her on the tremendous honor, and grateful that we have her here as a treasure in New Jersey and here in Teaneck and Bergen County, one of our counties. So with all of that, everyone have a great weekend. Linda, thank you so much again for sharing such great information. We encourage everyone to do a deep dive, in all of these links that are provided. And we look forward to seeing you next week for some more YWTV. Take care.